Okay, we're going, man. So this is the
All
first.
right.
This is the first segment we're doing for the LX mailbag. And
Yes.
I
So
actually
excited.
have a mailbag. I want you to know. So these questions came in digitally, and I took a lot of extra work to be able to put them on paper, to put them in a mailbag for the theater, for the theater of LX mailbag. So
Let me see this mailbag again. Let me see. Raise this mailbag.
it's
It's
yeah,
official.
it is. There's
That,
3 questions in here. There's just not a lot. We know what the questions are ahead of time. But
that's wild.
so what we thought would be interesting and helpful to our community is if people could write in questions that they have, that you experience on a daily basis, and get them answered live. They're good questions. They're questions that everybody is going to have at some point in their life, most likely. And why not disseminate the information as we have it?
I
So
like it.
this is the call out. If you are watching this and you want to ask a question, send us a message and we will add it to the mailbag and we will answer it live at some point on a video. All right, Jim, are you ready?
Hey, let's do this. And this is my own disclaimer. If I don't know the answer to a question, I'm gonna make it up completely, start to finish. But I will throw in a little asterisk at the end. Not evidence-based answers at all. Hopefully, I can give some good insight on most of these. But let's see what happens.
Here we go. All right, question number 1. What causes joint pain when the weather changes? Is that real or is it a myth? we got that question from someone who's in the Northeast, which actually makes sense because I'm in the Northeast as well, and it's oh man, weather's changing in minutes.
God, I love that first question for our LX mailbag. That is this is something that is a topic that came up probably in the first week of medical school and came up again and again. And it's definitely the recurring question, because when people come in, they always people with chronic aches and pains. I mean, there are people who really swear by this, that they can tell when weather patterns are rolling in and rolling out. So this answer is, and actually Andrea, who is my wife, commander-in-chief, also one of the co-founders of LX Medical. She worked in orthopedic surgery for a handful of years. And so her insight and what she's talked about in the past has been super helpful as well. But here's the tale of two two layers here. The first is science-based, and the other is what we call like anecdotal research, like when you actually are talking to someone and they tell you something that seems real. It's hard to ignore. The science base on this, there has never been a really solid connection, a scientific data research connection between weather and joint pain. And like it's not from a lack of trying. There was some this is just like a year ago. I was reading out of a magazine. There was a huge a relatively massive study done on this. It was like over 10 million cases. I kid you not. Retrospective. They're just looking back at all these cases. And they looked at weather patterns on that when they could, weather patterns on the days that people were seeing who have chronic back issues, knee issues, arthritis issues. And they tried. It was not through a lack of trying. The goal was to connect weather and joint pain. And they couldn't do it. They just could not find anything reasonable to say, yeah, there's even this soft connection. The authors really concluded that there was nothing really tightly linked. Now, on the other
pressure, anything like that?
Exactly right. And that's where the theory comes from. There's a couple things, right? Humidity, temperature, barometric pressure. Those are the 3 forces that they say, okay, these things change with weather. I think barometric pressure has the best claim. Okay. If there's science to go elicit from this. But the theory is the barometric pressure around us, weather is rolling in, the barometric pressure drops. It creates less pressure on our bodies and allows in our joints for the soft tissue structures to actually expand a little bit. And when that happens, people with chronic joint pains, it actually causes enough of a change beyond their normal chronic issues that it actually creates aches and pains beyond what they're used to experiencing. And if you've I have seen it. This is where it blows my mind. I have had people come in on a day where it's nice out and they're in the ER all day for whatever reason. And by the end, they say, I can tell there's weather coming. And you kind of laugh it off and say, oh, I mean, that's quite the talent. Good for you. And then you go drive home on a day that was nice, but before you left work, and you go to drive home and it's storming, pouring rain out. And it makes you wonder. I'm a firm believer. And when you see enough people, and you can see it, like seeing is believing, right? I've seen people accurately predict this. So I'm not going to say for sure that oh no, there's no connection, there's no science, because you see it over and over and over again. People swear by it, and so it's probably a combination of things. There tends to be a temperature change when weather comes in. The barometric pressure definitely drops. There's fluid in your joints, and there's these soft tissues that are allowed to expand and change as the barometric pressure around us drops and changes. So
never on a big scale study borne out. Interesting.
Yeah, exactly.
Okay.
Yeah, interesting. That's a great one. Good opening.
All right. Well, that's not definitive for our first mailbag question, but here we go. Mailbag number 2. What is known about, and this what is known about the effects of COVID-19 on pregnancy?
Yeah, that's a good one. And this is one where there's a little bit more good data on my end because Andrea, co-founder, wife, she's actually pregnant at the moment. And my sister, she's due any day now. And so between those two direct sources, I've and Andrea and some of our team members have been keeping a close eye on pregnancy and COVID-19. So far, the good news, the bottom line, pregnant women do not need to be, they don't need to see themselves in a high risk category based on the data so far. Let's remember for a second that COVID-19 is in its relative infancy stage. There's a lot of understanding left to be done on COVID-19, but the data is very pregnant friendly on the overall effects. When I look at studies around COVID-19, there are 3 places of origin of these studies that catch my attention. Anything out of Wuhan, because it's been, they have the most data because that was where the infection originated from. Anything from Italy, because that was like the global example of catastrophic COVID problem. And then anything from the United States, because we're winning the race in COVID-19 cases and the amount of data that is being collected. Yeah. So there's a lot of useful information coming out of that. And in neither of those 3 areas that I have seen studies from credible sources like JAMA Journal, basically our big medical journal, anything from the New England Journal of Medicine, anything from NIH, those things catch my eye. And the instance of pregnant women contracting COVID-19 is very low. The incidence of when they do contract COVID-19 and they get symptomatic, I think 94, 95% mild cases, which bodes very, very well. There has been no solid link at all between a COVID positive pregnant patient who then gives birth and then the baby just through birth or through breastfeeding getting COVID-19. Wow. There's really no data to support that at all. So that's very good news for pregnant women, given our current circumstances this summer and into fall. So far, there doesn't seem to be much of a concern between those 2.
Terrific. Okay. That was great. Question number 2 answered. All right.
Yes. Just stay away from barometric pressure questions, and we'll get some good answers.
All right. Our last one. What are your thoughts on people having annual physicals?
Do them.
Value, low value? What are your thoughts?
High value. Absolutely.
Why?
There's a little bit of so this is going to be I'll quickly try to maneuver into the overall answer and then my own take on it. But annual physicals, it is very hard for people to live 10 years, 20 years, 40 years down the road. It is, and no one should live like that all day, every day. But, there is never a time when someone comes in at 50 years old and you identify that they've been a diabetic for 10 years, or you identify that they have chronic kidney disease now that was that was not detected before because they weren't doing their annual physicals. There's not a single person, and there's not a single medical provider in that moment that says like, oh yeah, that was worth not looking at that once a year. And that's something I could have detected 10, 15 years ago that would have maybe given me another 10 years of life on the back end. So these annual physicals, they are meant to identify growing problems, and it's not meaningful to have one data point every 6 years, right?
Sure.
You have to be able to track data points. So when your cholesterol's a little bit off, or your blood sugar's a little bit off, or you have a kidney level that's a little bit off, you detect it early. You try to make some adjustments, and then you look at it again, and you look at it again, and you can much more effectively with data points make really good informed decisions on lifestyle and on medications, whether you need them or not. So that preventative aspect of an annual physical is worth it. Honestly, I'm on the other end. I'm not so much someone who says I like annual physical, maybe just go without them and only be seen by the time you get to 50, which again, I think is not a good decision. I'm more on the end of they don't do enough at physical exams to really assess nutritional status. And are there things in your lifestyle that you can follow through blood work over a lifetime or over many years to be able to optimize your day-to-day, right? Like your annual physical is very preventative based. It's just saying, hey, what is your risk for things in the future? I wish physicals did more to say, how are you doing today? And how are you going to be tomorrow? A little bit more in the moment as well, because that's what really resonates with people, right? Sure. They want to be able to go to a physical, be assessed, have some objective information, some lab work, and then be able to make decisions. All right, how can I have a great year? And how can I have a great, how can I continue to have great years 10 years from now, 20 years from now, 30 years from now, and not let things creep up on me? So I actually think that there could be more value in an individual's physical health assessment, annual physical. But bottom line, do them. Don't be one of the individuals who finds out at a very young age that there's something going on that was missed. It's not worth it. And catch things early is always going to be the optimal goal.
Okay, that's it. We're done.
All right.
Until next week. And again, as a reminder, if you guys have questions, anyone who watches this have questions, you don't have to be an Alex Medical client. Send in your questions. Right. We're happy to answer them and go through this and share those answers with folks because it's really helpful for everyone to hear the answers to these questions.
You got it.
All right. We'll talk to you soon.
Awesome. Thanks, Andrew. We'll see you.
Bye, Jim.